Certainly, we want to take this time to thank Almighty God who's allowed us to come together and to work diligently with the city of Philadelphia, the city of brotherly love. It is our intention to really see this immunization, this vaccination come through for the community. We realize that the community needs immunity, and this is for every community. And so the city has really put their best foot forward in helping us to understand that every community needs to be vaccinated. And let me say to you that this time that we have here in South Philadelphia, where people are going to be vaccinated and the community is coming together to get what they need so that we can stop this dreadful disease. I'm happy to welcome the city. I'm happy to welcome our mayor and city council. And at this time, our mayor, who's doing an outstanding job in making sure that we can get this immunization, this vaccination system going. We welcome him at this time. Mr. Mayor.
Good morning, everyone. And first, I'd like to thank the Health Department, Bishop Robinson, Yesha Ministries, and Councilmember Johnson for helping make this partnership happen. Also, want to take a moment to acknowledge this point in time in the pandemic. It's been over a year since the first case of COVID-19 was confirmed here in Philadelphia. And yesterday marked the anniversary of when many restrictions went into place to mitigate the spread of COVID-19. Since then, the city of Philadelphia has prioritized getting the vaccine and other resources to our communities of color, which we know have been disproportionately impacted by the virus. Today, we are really excited to open the first city-run vaccination clinic in South Philadelphia here at the Grand Yesha Ballroom. Now that the vaccine supply from the federal government is increasing, and with the success of the Center City Vaccination Clinic, we're eager and able to get more sites up and running in our communities that need it the most. Because of partnerships like this one, we have been able to administer over 500,000 doses of vaccine so far, with nearly 150,000 people fully vaccinated with both shots. And we are confident that we can improve the equity of our vaccine distribution efforts and get Philadelphia one step closer to defeating this virus. We've been through a number of different iterations of clinics and mass clinics, FEMA, all the stuff we're doing, but we also find that people from the neighborhoods sometimes are reluctant to come to other places. So we want to try to bring as many vac sites to neighborhoods as possible so people can leave their home, walk to the site, get on a short bus ride or whatever, and get done what they needed done. We need everybody vaccinated to get through this. We feel that there's this light, the light at the end of the tunnel is getting bigger and brighter, and we're moving forward to that light, and want to make sure that everybody gets an opportunity to be vaccinated. So now I want to turn it over to Dr. Farley.
Thank you, Mayor, and thank you for coming. First, I want to thank Bishop Robinson and the Yesha Ministries for hosting this clinic here today. The clinic is run by the Health Department and many other staff representing the Health Department and city agencies. But we can't do this without having a site to do this, so it's really wonderful to be here in South Philadelphia offering the service. Just to put this in perspective, we are offering vaccination through a variety of different healthcare providers in the city. That includes hospitals, federally qualified health centers, and other clinics, including urgent care centers, pharmacies, an increasing number of pharmacies, and then community providers like the Black Doctors COVID Consortium that you probably heard about. And then, of course, you know about the Center City Vaccination Center at the Convention Center. Now, Center City Vaccination Center is doing very well. They're vaccinating some 6,000 people per day. But in discussions with community members, it's clear that not everyone wants to go there. And that traveling to the convention center is a bit of a barrier. We need everybody to be vaccinated, so we want to reduce all those barriers possible. So we need, as a complement to the Center City Vaccination Center, we are doing these clinics in communities across the city. We've been running clinics in North Philadelphia, and in Kenyatta Park, and West Philadelphia. And this week we're expanding to Nicetown. We were up in Nicetown a couple days ago. And then today and on Friday we're here in South Philadelphia. Here, we're going to be on East of Broad and West of Broad Street. Next week, clinics that are being led by the fire department will be in the Northeast and the Northwest. So the people who are here today for vaccination are people who meet our Phase 1A or Phase 1B criteria, which means that they're either a frontline essential worker, or they're over the age of 65, or they have a medical condition that puts them at greater risk for infection. And they're either here because they were in our database, it's on our website, the Vaccine Interest Database, and they were invited, or they were referred here by community organizations, because we know that many people may not get their name in that database, but they might need to be vaccinated as well. So it's a combination of those folks. They will be vaccinated today using the Pfizer vaccine, because the vaccine needs 2 doses, and so they'll be giving 2 doses 3 weeks apart. So the same people will be back here in 3 weeks, and we'll be back here in 3 weeks to deliver the second doses. And we will continue to do this service at this site on a weekly basis as long as it's needed. Today we have a total of, I've already forgotten, is it 8 stations, Jim? 10 stations, 10 different vaccinators in there, and we anticipate vaccinating about 350 people. We'll be here from 10 o'clock to 4 o'clock today. So that's not everybody. We have a big city to vaccinate, but with each person we vaccinate, that's one step closer to ending the epidemic. Thanks very much now, and I want to turn it over to Councilmember Kenyatta Johnson, who's essentially helping us connect up with the community to make this work.
Good morning, everyone. First and foremost, I want to thank Bishop Darrell Robinson for graciously opening up the doors of Yesha Grand Ballroom, hosting the vaccination site. I want to thank our mayor for stepping up to the plate and making sure that we are bringing vaccination to the people, which are in our communities. And so most of you may or may not know, I'm born and raised. I'm in South Philadelphia. My parents grew up on 20th and Emily Street, right around the corner. My mom was a member of this church, and so it's very fitting that this church, which is the cornerstone here in Point Breeze, South Philadelphia, is on the forefront and making sure that people are coming out and being vaccinated. I want to thank Dr. Farley for leading the efforts and making sure that, again, those people who are most vulnerable, when we're addressing the issue of the health disparities and making sure that particularly black and brown people are vaccinated equally across the board, and we're closing that gap, it's critically important that sites like these are in the core of the communities. And so I just want to thank, and I encourage everyone as well to get vaccinated. I got my first shot, not from this particular operation, but from another operation. I'll get my second one on the 31st. And so in order for us to get back to normal, I encourage people to get vaccinated. But most importantly, this is a deadly virus. I'm going to say it again. This is a deadly virus. I have met countless people. I have met countless constituents who have lost loved ones to this virus. So take it serious, take it serious, take it serious. I don't want to get a phone call from someone who said they lost the life of a loved one, or I got a call that a person who I was interacting with lost their life to this virus. And so I encourage everyone to get vaccinated. And again, I thank our mayor and Dr. Farley, and most importantly, my big brother, Bishop Darrell Robinson, for hosting this site. Thank you.
Can I take some questions from the press?
This might be for Dr. Farley. I guess we were reporting on our morning show that you guys were taking walk-ins here, and I guess there was some confusion and people were calling us saying they're turning me away. How is it working as far as people signing up online, and then you also, if you can just explain?
Right. So all of our community clinics, we are inviting people to schedule appointments. We're starting with that with the people who are in our vaccine interest database. In some cases, we've also gone to community groups to schedule appointments. But we have found in some of our community clinics that there are vacant appointments. They're open appointments. We don't want to make this opportunity go to waste. So for some of our community clinics, where there have been vacant appointments, we have taken walk-ups. That's managed on a clinic-by-clinic basis. Here, my understanding is that all of our appointments are filled, so we do not expect to take walk-ins today. So if anybody wants to be vaccinated and they can't get in today, they should go into our website, www.phila.gov/vaccineinterest, put in their name to get in our database, and they'll be invited in the future. Or they can call 301 and they'll get in our database and they'll be invited in the future.
I saw somebody making a list. There was a woman who came in and she said, I think that she looked on a list.
Right.
Are you encouraging people to come in and get on the list?
No, but for people who come and don't get the right information and they believe that there is a walk-in, we have people out here who will help them be in our database and scheduled for the future.
So the zip codes that are out for the people that are eligible to get the walk-ins, there's 22 of them. The concern I'm hearing in the community is some of the zip codes not include areas that are getting very gentrified right now, but still have a big immigrant population, big populations of people that are still underserved, even though the zip code itself isn't. Can you talk a little bit about how you identify what zip codes to use and what can be done to rectify that problem?
So first of all, what we're talking about is the convention center clinic. So for the convention center, we have said for people in 22 of the lowest vaccinated zip codes, if they should still try to schedule an appointment, but if they can't, they can walk in, and to the extent that we can handle them, we will take them at the convention center. Those 22 were selected just based on the lowest vaccinated zip codes in the city. So a strict number, that's vaccinations per capita. We recognize that more people across the entire city want to be vaccinated. And so everybody's going to have opportunities, everybody's going to need opportunities to be vaccinated in the future. But we do have a compelling issue of racial equity. We know that African Americans, we know that Hispanics are being under-vaccinated right now. And so those people tend to be in those lower vaccinated zip codes. So we need to address that, and that's why we set up those plans.
Just to follow up, so in the issue of racial equity, so the concern that I'm hearing though is some of the zip codes not included. The reason they're not included is because of gentrification. So younger people with more money moving in who are vaccinated or who have had access to the vaccine, but it's leaving people that have not had access to the vaccine, people who are falling victim to racial equity issues, and they're also not eligible to do wildfires now too.
So, I mean, this piece is just one piece of a much broader strategy to address that. So we have other providers, for example, the federally qualified health centers, we have pharmacies, we have hospitals, all that are doing outreach for vaccinations, and are all being directed to populations that are being under-vaccinated. And so we have to, this is one piece, and the piece has to be practical. We can identify people when they come to the convention center based upon their zip code. We can't go to a smaller level and say, okay, are you in this particular neighborhood within that zip code?
So community groups will be something you guys are leaning on then going?
Community groups, and again, and outreach of the whole range of providers out there that are offering vaccinations.
Thank you.
All right, thank you.
Jim Kenney. Buenos días a todos. En primer lugar, me gustaría darle las gracias al Departamento de Salud, al Obispo Robinson, a los ministerios de Yesha y al miembro del Consejo Johnson por ayudar a que esta asociación sucediera. También quiero tomar un momento para reconocer este punto en tiempo de la pandemia. Ha pasado más de un año desde que se confirmó el primer caso de COVID-19 en Filadelfia. Y ayer marcó el aniversario de cuando se aplicaron muchas restricciones para mitigar la propagación del COVID-19. Desde entonces, la ciudad de Filadelfia ha priorizado la obtención de la vacuna y otros recursos a nuestras comunidades de color, que sabemos que se han visto afectadas desproporcionadamente por el virus. Hoy estamos emocionados de abrir la primera clínica de vacunación administrada por la ciudad en el sur de Filadelfia, en el Grand Yesha Ballroom. Ahora que el suministro de vacunas del gobierno federal está aumentando y con el éxito de la clínica de vacunación del centro de la ciudad, estamos ansiosos y capaces de poner en marcha más sitios en las comunidades que más lo necesitan. Debido a las asociaciones como esta, hemos sido capaces de administrar más de 500,000 de dosis de vacuna hasta ahora, con casi 150,000 personas totalmente vacunadas. Ahora las palabras de Dr. Farley. Ahora estamos ofreciendo la vacuna a través de muchos canales como hospitales, centros de salud calificados, otras clínicas y farmacias. También a través de proveedores comunitarios como el consorcio Black Doctors COVID-19 y el centro de vacunación del centro de la ciudad en el centro de convenciones. El centro de vacunación del centro de la ciudad está funcionando muy bien de muchas maneras y están vacunando a 6,000 personas al día. Pero en las discusiones con miembros de la comunidad está claro que no todo el mundo puede ir o está dispuesto a ir al centro de la ciudad. Así que hicimos un complemento al centro de vacunación de la ciudad. Hemos estado dirigiendo clínicas en el norte de Filadelfia, en Juniata Park y en el oeste de Filadelfia. Esta semana nos estamos expandiendo a Nicetown, al sur de Filadelfia, al este y el oeste de la calle Broad. La próxima semana nos expandiremos a las secciones noreste y oeste de Filadelfia. Las personas elegibles de la fase 1B se basan en condiciones de edad o médicas. Las personas elegibles están siendo invitadas desde la base de datos de interés de vacunas y puede ser referido por organizaciones comunitarias. Actualmente estamos usando la vacuna Pfizer en sitios comunitarios y volveremos en 3 semanas a cada sitio. Estas clínicas en los vecindarios de Filadelfia son de fácil acceso. Seguiremos haciendo esto hasta que ya no sea necesario. Hoy las clínicas tendrán 10 estaciones, estimado 350 personas serán vacunadas y la clínica estará abierta de 10 de la mañana hasta las 4 de la tarde. Con cada persona que reciba la vacuna, estamos una persona más cerca de poner fin a la pandemia. Muchas gracias.